works only occasionally.
Hello everyone and welcome to The Joint. Today we have special guests Giselle and Nicole competing for the Bone Trophy. Here's how the game works. I'm going to ask a question about the joints and they're going to raise their hand, and whichever one's first is going to get a 10 point if they win and subtract the 10 points if they get it wrong. Let's get this joint started. First question. What are the distinguishing features of synovial joints? Giselle.
Articular cartilage, fibrous cartilage, and joint cavities?
No, unfortunately that is not the correct answer. Minus 10 points. Nicole.
Articular cartilage, fibrous cartilage, joint cavities, and reinforcing ligaments.
Correct. 10 points for Nicole. Next question. What are the capsules of fibrous connective tissues that enclose the synovial joint surfaces lined with? No answer. The correct answer is that they are lined with the synovial membrane. No points for anyone. Next question. Describe the mobility of synovial joints. Nicole.
They are immobile.
Wrong. Giselle.
Nope, they're actually freely movable.
Correct. Both contestants are now at 0 points. Last, more questions about the synovial joints. What are two things that act like a ball bearing to reduce friction during joint activity that are often associated with synovial joints? Uh-oh, tiebreaker. Rock, paper, scissors, go. Giselle.
The bursae and pannus.
Wrong. Nicole.
Bursae and tendon sheaths.
Ding, ding, ding. Nicole wins 10-0.
Hi.
Hello and welcome back to Pass the Joint. We're going to take a closer look into clinical advances of bone repair. It's no secret that our bones have incredible healing powers. However, sometimes injuries and conditions are too severe for the body to heal themselves. During our segment, we'll go over some instances where the body needs a little help from man. Research shows us that electrical stimulation of fractures increase the speed of healing in large and slowly healing fractures. On the other hand, if you have a fresh fracture, you can head on over to the doctor to get an ultrasound. Daily exposure to ultrasound waves can increase healing time up to 45%. If you have ever had a non-union fracture, then you know how painful skin grafts can be. A potential alternative to this healing method is a free vascular fibular graft technique. This technique grafts normal blood vessels along with bone sections, allowing for a good replica of bone before the injury. Attention! If you or a loved one has been diagnosed with osteoporosis, you may be entitled to financial compensation. Osteoporosis, a condition in which the bones become weak, has been linked to tobacco exposure. The risk factors of smoking also include heart disease, lung, and esophageal cancer. If you or a loved one is affected by any of the following bone diseases, osteoarthritis, rheumatoid arthritis, or gontiarthritis, we have treatment facilities available to help with their care. There are multiple forms of arthritis. Osteoarthritis is the most common form of arthritis and is a chronic degenerative condition that typically affects the aged. As this disease progresses, bone spurs, thickened and extra bones, grow. Many patients experience crepitus, which is a crunching noise within their joints. Rheumatoid arthritis is a chronic inflammatory disorder. Over time, the inflamed membrane thickens into a pannus, which is an abnormal tissue that erodes cartilage. This scar tissue ossifies, and the bone fusion that forms is called ankylosis. Gontiarthritis is a disease in which uric acid accumulates in the blood. If you or a loved one is suffering, please don't wait or hesitate. Call 1-800-99-LAW today, and we will give you a free consultation. The next technique is for growing children. Because they are still growing, they would need a self-extendable endoprosthetic. This device grows with the child, gradually elongating with knee bending while increasing tension as soft tissue grows. A non-mechanical treatment for a bone injury is a vascular endothelial growth factor, or VEGF. It is a protein that has the potential to create new bone tissue. Experimentation on mice have shown that there could be some merit to this process. Researchers have looked into several more bone substitutes to fill in non-union gaps, from crushed cadaver bone, pro-osteon, and ceramic bone.
This afternoon, Sean, I met in.
Oh, it was inside.
Oh no. Oh my god. Shut up,
Who is that?
people. Oh my god.
Hey Jim, we're back in the rehabilitation tent with our latest injured athlete. Standing here with me is Dr. Britton, who will update us.
Hello. Based on the evaluation we done on the field, we're dealing with a caused fracture to the wrist. This is an injury to the pivot joint, which is a common injury in this sport. There also seems to be another fracture to the right ring finger that we have taken an x-ray of due to the impact of the made on the wrist that could possibly prevent mobility.
For those of us who don't know the language of medicine, could you please explain?
As you know, there are multiple joints with different shapes within the body that allow different motions, such as the plantar, hinge, pivot, condyloid, saddle, and ball and socket joints.
The joint that was affected in the wrist was a pivot-shaped joint, which allows rotational movement due to the rounded bone moving around its own axis.
I noticed that you were handed a copy of the x-ray. Do you have further information on her other hand injury?
Based on this x-ray, she has managed to dislocate her proximal interphalangeal joint in her right ring finger.
This joint is a hinge joint in which the slightly rounded end of the bone fits into the slightly hollow end of the other bone, so that one bone can move while the other remains stationary, making a back and forth movement.
They've bandaged her up, but it's best to prepare her for surgery as soon as possible. I gotta go now. Oh!
Back to you, Jim.
Good punch.
Welcome back. Today we'll be discussing the different parts of joints. Joining us today, we have two joint specialists, Dr. Giselle and Dr. Sydney.
Hello, good morning.
It's nice to have you here with us today. Now, could you please inform us on joints?
Joints, which are also called articulations, are very important parts of our body. Not only do they hold our bones together, but they also give the rigid skeleton mobility.
Now, I know that joints are classified both functionally and structurally.
Functional classification focuses on how much movement the joints allow. So we have our synarthrosis joints, which are immovable joints. We also have our amphioarthrosis joints, which are slightly movable joints. And lastly, we have our diarthrosis joints, which are freely movable joints.
There are three main types of structural joints. We have fibrous, cartilaginous, and synovial. Each have different functions and are located in different types of places within the skeleton.
In fibrous joints, the bones are united by fibrous tissue. In cartilaginous joints, the bone ends are connected by cartilaginous. Could you help me out with understanding the synovial joints?
Of course. Synovial joints are joints where the articulating bone ends are separated by a joint cavity which contains its own fluid. An example of synovial joints would be all the limbs of the body.
So remember that our joints are very important. Thank you, Dr. Britton. Thank you, Dr. Washington.